Thank you very much again, everyone, for joining. We're going to be starting in about 3 minutes. Again, thanks everyone for joining. We're just going to be starting in a couple of minutes once the clock strikes 6 p.m. Just another minute till we start. So Q&A is open and you can ask questions by pressing the Q&A button at the bottom. And we're just going to start in 1 minute as people are joining. Well, thank you very much, everyone, for joining the ASI's first webinar. New time calls for embracing new technologies. So very excited to be able to host this. My name is Matthew Lesh and I'm the head of research at the Adam Smith Institute. This webinar is really going to focus in on some of what the international response has been to the COVID-19 crisis, both from a public health perspective, but also especially from an economic perspective and how different countries have handled it. Our first speaker this evening is going to be Sam Bowman. I'm sure will be familiar to many of you as the former executive director of the Adam Smith Institute, as well as a senior fellow. And he's also the incoming director of competition policy at the International Center for Law and Economics. So I'm just going to hand over to Sam.
Thanks very much, Matt. It's really strange to be here, but I note that we have more participants here than any individual Adam Smith Institute event that I ever organized. So maybe there are a few silver linings to this cloud. I'm obviously not an epidemiologist, so I'm not in any way going to comment on the government's response in that respect. But I think there's a lot of interesting things to think about and to consider about the economics of this, and in particular, the UK government's economic response. Given that I come from a very free market perspective, you might be surprised by some of the things I'm going to say, because on the whole, I'm very supportive of a kind of big government solution to this problem, or to a big government response, with a lot of government spending that we've seen. But I want to explain why that is. And I think the really key fact for me, or the key belief that I have about this, is that it's not a normal recession. It's not like a 2008 style recession or a 2001 style recession, where the factors that kind of led to it are sort of contained within the economy. The things that are very different about this recession to almost any other recession we've had are that first, it's self-inflicted. A lot of the recession, not all, but a lot of the recession is caused by the state saying, I think correctly from an epidemiological point of view, that people have to stay home, lots of businesses have to close, we need to increase the amount of distance between each other to limit the spread of this disease. And that makes it quite different to recessions where we're trying to stop that from happening. We're trying to get businesses to operate. We're trying to get people to carry on their lives as usual when they might not be doing that otherwise. The next is that it's probably temporary. So a lot of the factors that are reality at the moment, the fact that we have to stay indoors for most of the time, are temporary things. So businesses that are not viable for the next 3 months, that were viable prior to this, probably would be viable after this 3 month or 6 month or however long it lasts period is over. So businesses that can't keep themselves afloat for this period time, that still are solvent in that period afterwards, are probably still quite valuable from an economic and social point of view. The third point, which was related to that, is that this recession doesn't really care if you're profitable or unprofitable or solvent or insolvent. There are lots of very good businesses. There are lots of great restaurants and bars, for example, that in normal times would be perfectly solvent, that just simply cannot be solvent under the current circumstances. And so unlike the view that some people have of recessions, which is that they kind of clear away companies that are fundamentally unprofitable and allow those resources that they're using, the labor and the capital investment and things like that, to be directed to more valuable uses. This isn't really like that. Lots of businesses going to the wall just would be very valuable in other circumstances. And fourthly, because of all this, it's not businesses' fault. It's not that we want to see businesses go to the wall, and it's not that we should have seen lots of businesses provide for this kind of mass pandemic. It's kind of unreasonable, as Jonathan Bortes has said, to expect the local Thai restaurant to have kind of a pandemic insurance plan and to kind of make provisions for a once in a century pandemic. This is a very, very unusual situation, and it would be very, very difficult to insure against this, because it's affecting so much of the economy, because it's not an idiosyncratic risk. It's not like one person being affected by this, it's the entire economy and entire sectors of the economy being affected by this. So there also finally isn't an obvious private alternative to this. So for me, the response has to be about putting the economy into kind of stasis or cold storage. What we want, if we think that businesses that were solvent and viable and profitable up until a month ago will still be profitable and solvent and viable in 6 months' time, then we need to put them as much as possible into cold storage. So that means them not laying off their workers, them not being evicted from their premises, them as much as possible shutting down and no longer having expenses going out, or given that they have no money coming in, but not being wound up, so that we lose the kind of valuable patterns of entrepreneurship and things like that that have led to those businesses existing in the first place. It's very difficult to find a combination of labor and talent and resources that is profitable, that does kind of allow you to make money and satisfy customers in a valuable way. And to lose that isn't easy to replicate. And part of a recovery is that long, slow, difficult process of replicating that and trying to repeat that. So if we can avoid that long, slow process, we can make this period a one-off and not something that gives us a 3 to 5 year period of very, very unpleasant readjustment afterwards. So the economist Wojtek Kopczuk, and apologies to him if I'm mispronouncing his name, has a great line about how the economy doesn't collapse on weekends, even though lots of people stop working. Lots of places in Europe that just basically shut down over the summer because everybody's on holiday, they don't have a long persistent recession after that, because the patterns of the employment, the contracts are all designed with that in mind. And everybody knows that after this period where there's not that much money changing hands, things can go back to normal. And that's the kind of thing that we need to replicate. So there are a few options for doing this, and I think that the UK approach is actually really good. I and many others had called for something like this. The centerpiece of the UK's response is what's called the job retention scheme. And what this does is allow any business, no matter how big it is, to furlough its workers. And furloughing just means they're not working for you for this period. So it allows you to put those workers basically on holiday for the next X number of months on 80% pay, and all of that pay is covered by the taxpayer. They're not allowed to work for the business. So if the business could productively have them working from home, there's no incentive to have those people furloughed because the business loses their labor. But for those businesses that do think that they'll lose enough of the kind of value created by those people by having them work at home or not being able to work at all, this is a way of then putting those employment contracts into kind of cold storage. And it will be very expensive. The IFS is estimating that it will cost per 10% of workers, it will cost about £10 billion over 3 months. So it's a lot of money. But we have to bear in mind that the money in this case is largely a transfer. And again, this is somewhat different to the usual kind of stimulus spending that we see many people call for, which I usually oppose in recessions. And usually people want to have the government spend money to kind of get the economy going again. There's a kind of view that comes from the kind of Keynesian view of recessions, which is that you need a kind of spender of first resort or spender of last resort to start infrastructure projects and so on and get money flowing around the economy. And I want to really stress that is not what's going on here. That is not what we're trying to do here. This is better thought of as, rather than being a macro policy, this is like a big micro policy. The objective here is purely to keep individual businesses going, keep their employment contracts maintained with their workers, keep those workers in those jobs, and obviously to keep those workers who wouldn't have money and who would be unemployed otherwise to be able to pay for the expenses they need to live. So we've also seen universal credit, which is the kind of unemployment insurance system in the UK, quite a generous increase in the amount of spending on that. Similarly, housing benefit. We've seen what's called a business rates holiday, which is the land value tax that business rates pay. They won't have to do so for most of the year. There's a mortgage holiday for people with mortgages, although again, that's just a deferral of payment. So people with mortgages can take advantage of this mortgage holiday. They're not going to be spending any less over the long term. They're just not having to pay their mortgage payments right now. So it's not comparable to a rent holiday, which some people have been calling for, which I think would not be a good idea. And we've seen very, very significant amounts of money guaranteed to provide business interruption loans. So the businesses that do feel that they would be solvent in the long term, but are illiquid in the short term, can access these guaranteed loans with the state backing them. And those are quite significant. There's also measures for the self-employed, which I won't go into because we're limited in time. I've proposed a system modeled on the student loan system for everybody else. I think inevitably in any scheme like this, there will be people who fall through the cracks and having a kind of backstop of what I would propose as an income contingent loan system for people who, for one reason or another, maybe they weren't in work for long enough, maybe they can't access universal credit for bureaucratic reasons, to allow them to access an income contingent loan where they can borrow an equivalent amount of money and then pay that back when they're able to through their taxes, through say a higher national insurance rate later on, might be a way of guaranteeing that nobody falls through, or almost nobody falls through the cracks. Long term, the question depends on what does long term look like. If in 3 months' time we come up with a vaccine or an effective antiviral treatment for this, then maybe we can get back to normal. If it turns out that we have to adjust, like the countries like South Korea, Taiwan, Hong Kong, which Saloni will talk about in a minute, maybe our lives are going to be quite different for quite a long period of time, in which case we do want some economic readjustment taking place. It may be, for example, that many of us have to work from home for a long time. It may be that many restaurants cannot be viable for a long time. And if that becomes the case, then the government's job will have to shift from keeping the economy in cold storage to facilitating a movement of resources from things we used to do to the new world, to home deliveries, to better broadband provision, for example, so that we can have better video conversations, things like that. But all of this depends on how long we expect this period to last for. And if it's a short amount of time, then the cold storage approach will work. But I think that the key point to bear in mind, especially for people who usually would take my view of usual recessions, which is The job of the state is to keep the overall economy stable, but not to prop up individual businesses. In this case, this is a truly exogenous shock, and it's one that is truly uninsurable except for by the state. It's very unusual times. I don't think I'd ever think that I would hear myself saying the words that I've been saying, but I'm very, very pleased with what the UK government's done so far. And I think, unbelievably, they've really stepped up to the plate in terms of the economic response. Thanks.
Thank you very much, Sam. I think we're next going to go to Morgan Schonmeier, my colleague at the ASI, our head of external affairs, who's going to be speaking about the American response.
Hi, everyone. Thank you so much for joining us for the first ASI webinar. As Matt already said, at the ASI, we're super excited that we can provide this for you. Again, like Sam said, reaching more people than we can in our ASI offices, including people not in the UK. So I'm going to talk a bit about the US approach to coronavirus. I'm assuming most of the audience is from the UK, so I'll give a tiny bit of background on how it's developed there, but you can imagine it's very similar to how it's developed here in terms of growth, spread, all of those things. Have been pretty consistent trends across several countries like the UK, USA, Italy, Germany, etc. So I first heard about coronavirus really when I was going back to the States. I was flying to California on January 15th. And in the airport, they already had these announcements. If you've been to Wuhan area in the last 14 days, you're experiencing any of these symptoms, please contact your health provider. 3 days later, 4 days later, there was the first case in the US in Washington State. That was on January 21st, which was the day after the first case was recorded in South Korea. So we're seeing a similar spread. First recorded death was on February 29th, and by March 17th, every state had a confirmed case. So this was a very quickly spreading disease, regardless of early measures that were taken to kind of halt travel and screen people as they were coming into the US. For kind of to contrast it to the UK style approach, I think that there are probably two big differences that really relate to the way that the US is structured, which is different from the UK. So there's a difference between the state and the federal provision of government, and then the legislative versus the executive branch. So having those two separations, which aren't present in the UK, have really changed the way that the US approaches coronavirus. I think that the state level has done very well at leading the public health response, and then the legislative branch has done very well at leading the economic response. And I'll kind of touch back on those as I go through some of the issues and positives of how the US has approached this. The federal level hasn't really given much legally binding advice the way that the UK has. Any legally binding advice has been done mostly at the state level, and not all states have implemented binding lockdown orders. They've suggested that you stay home, work from home, don't go to restaurants, but nothing's been broadly said for the entire country. Some states started locking down as early as March 19th. Everyone in the UK will know that our lockdown was announced on March 23rd, so we're kind of still at the same timeline. But because there's no federal response, there's really differences across states about how much economic activity is going on. Are restaurants still open? Are bars still open? Stores, supermarkets, and if people are still even going to work on a regular basis. And then the difference with the legislative versus the executive branch. Again, I think the legislative branch has done really well to lead the economic response, whereas the executive branch has kind of sown a little chaos into this whole thing, as we can kind of expect after the last 4 years. It was a very depressing time to see the president downplay the seriousness of this disease and the seriousness of the pandemic and whether or not it was going to spread. Whether or not you think we're overreacting and you think that maybe we're causing a lot of economic damage, to downplay this was discouraging from our leadership. From a public health standpoint, like the UK, Sam didn't touch on it a lot, but I think the testing is a huge setback in the US. The CDC had a few issues with scientific error. They created a test that proved to be inaccurate, but they kind of were held back by bureaucracy and didn't want to create a new test or really distribute these really important measure, which would be testing. So they didn't want to adopt the WHO test. They ordered states to use the defective test kits, and they didn't provide any measures for private companies to create tests. That's because the bureaucracy in the states, they have a massive private healthcare infrastructure, as we know, huge pharmaceutical companies who are ready, willing, and able to create these tests, but the Food and Drug Administration, which has the power to authorize the tests, was operating on their non-crisis measures, which takes months, years to approve tests. And therefore, we had labs that were sitting on tests ready to use them, but weren't able to get approval. So that's something where the US had this huge advantage built in. They have a poor healthcare service for people who don't have access. If you don't have access to healthcare, this is the sort of time when you're royally in trouble. But if you do have access to healthcare, you're going to get some of the best care in the world. And the private healthcare system was really a huge advantage that the US had, which was really crippled by the bureaucracy of the FDA and the CDC. And it's something that we lost several weeks, if not months, on the barriers there with testing, when we really could have been doing much more effective tracking and tracing and containing it to different communities. But by the time that passed, that we had to move towards more economically damaging proposals like social distancing and working from home. So in terms of the economic response, again, in a time where we have a very divisive president, and this whole thing came off the back of his impeachment trial, we are in a huge partisan kind of mindset. Everyone's looking out for their own backs, and but we see the legislative come together to create these three huge stimulus packages in a pretty big bipartisan effort, which is encouraging. So there was first a $8.3 billion emergency spending bill, which focused almost exclusively on healthcare and providing money for the CDC for a health emergency fund to develop vaccines, and $500 million over 10 years to create a remote healthcare program to help keep people home and make sure that we can access people in rural areas and stuff like that. Then there was another one, which was called the Family First Coronavirus Response, which provided a very limited extended family medical leave and paid sick leave. I say very limited because it was encouraging, but it only applied to less than half of all Americans. You have to work for a company with fewer than 500 employees, and that does not actually apply to very many people. States loosened eligibility requirements for unemployment, meaning you don't have to be searching for work, or they've also lessened the waiting periods. And then the final stimulus package is probably the one you've all heard of, which was the $2 trillion stimulus package. In terms of scale, it's unprecedented. In terms of speed, it was unprecedented. There was a lot of partisan back and forth, which was discouraging, I think, but to be expected with the American system. And there were a few key provisions. There was a direct cash transfer. Everyone earning under $75,000 will get a one-time direct cash transfer of $1,200. It's not very much, if you ask me. One of the cons of this proposal is it's not adjusted for living expenses. If you're living in New York City, you're going to get $1,200. If you're living in rural Alabama, you're going to get the same. But the cost of living is so extraordinarily different that people in metropolitan areas are not going to be served particularly well by this. It did expand unemployment, which was very useful. The US saw 3.3 million people apply for unemployment in 1 week, as opposed to 282,000 the week before. So we have unprecedented numbers of people applying for unemployment. So this expansion is welcome. And it also includes $500 billion for loans and loan guarantees. So Sam mentioned the employee support, putting people on furlough. The way that the US has done it is this loan guarantee mandates that companies must keep 90% of their employees where practicable as of March 24th until September 30th if they want to be eligible. So what this means is they'll take out the loans, the companies will take out the loans, and it will basically go directly towards paying salaries. It's not a bailout, like Sam says. It's about keeping solvent companies solvent, which is important. I think Sam is right. You'll hear a lot of libertarians and free marketeers talking about keeping businesses afloat, which is something you wouldn't normally hear. But again, this is something that is very different to a normal shock in the economy. So the positives of stimulus, or it does that and makes sure that solvent businesses can remain solvent. It expands the eligibility for benefits and the benefits themselves. And it offers some cost of living relief. So student loans are suspended. There's relief for mortgages and rental payments, and you're not able to be evicted in certain states during this time. But some of the negatives is, again, the cash transfer is only a one-off. So if you ask me, $1,200 isn't very much. If you're paying rent, if you're buying food, if you have a child to take care of, it is a limited amount. It doesn't account for cost of living and in different states. And there are also lags in payments and benefits, which is to be expected when you have 3.3 million people applying for the same benefit virtually overnight. So the US has approached this fairly similar to other countries, but again, the federal and state breakdown is very different. So most of the pressure for the public health standpoint comes from state level. States are instituting their own lockdowns. The governors of each state are really putting pressure on Trump and the legislature to make sure they're getting the tests that they need, that they're getting the financial support that they need, because the states aren't really able to keep themselves afloat without federal support. States just don't have those resources. They need to be focusing more on state provision of resources like schools or things like that. So it turns out that the states are better at the public health provisions and making sure they're keeping their citizens safe, whereas the federal government has been much better at providing the economic response, which maybe was always to be expected with our system. But it will be interesting to see if there needs to be a federal response for lockdown measures, because the US is not following lockdown measures particularly effectively. Unfortunately, there are a lot of people that are still going out, meeting with friends, eating at restaurants, going to bars, having barbecues, etc. So we have to hope that they can really get their act together and start social distancing properly, or else there will be a federal mandate. And that will have to be something that will be incredibly well thought out. It will have to take a lot of time. It will have to be airtight before they implement it, or we will see a lot of challenges from the states, which could lead to a confusing legal battle or something of the kind, which is not necessarily what we need. People need a lot more clarity from the federal government. But that's basically the summary of the US. I'm happy to talk more in questions, but I want to get on to Saloni so she can tell us about experiences in Hong Kong.
Thank you very much. So next up will be our good friend Saloni, who is our meme master at the ASI, but also a PhD student at King's College, and wrote an early article critiquing some of the UK government's approach that of course has now changed. So over to you, Saloni.
Hi, so I'm Saloni Datani. I'm a PhD candidate at King's College London and the University of Hong Kong. So I'm currently in Hong Kong right now, and I've grown up here. I moved to London to study. And so I can talk about the response in Hong Kong and sort of how it's drawn on the experience that we had in 2003 from the SARS epidemic. Some of the epidemiology. I have a background in biomedical science, so I'm happy to talk about that as well. So I think the first thing to mention is that most people in Hong Kong remember the SARS outbreak in 2003. So a lot of the measures that we've been taking are almost normal and sort of expected because we remember them from that time. So for example, there are some countermeasures that have been implemented since then have not even sort of stopped. So for example, there are temperature checks at airports that have been routine since 2003. They've never stopped. Their hand sanitizers are common in shopping malls and office buildings. Elevator buttons are sanitized every few hours. Things like that are very common here. So in terms of the response in Hong Kong, there have been lots of countermeasures that have been taken fairly early. And again, that's because of the memories of the SARS epidemic in 2003. So these countermeasures were taken both by the government and the public. And I think one way that Hong Kong differs from lots of other countries in the world is that most of the response, most of the countermeasures have come from the public or have been because of public pressure rather than top down from the government. So for example, it's very common to wear masks here. If wear a surgical mask if you're feeling ill, if you have a respiratory illness. And so mask wearing became really common as soon as the epidemic sort of began in Hong Kong. But also just a few days after the first case was confirmed in Hong Kong, schools were closed. And then classes at universities were closed, such as my own, and people were strongly recommended to work from home. In Hong Kong, we have a different approach from the UK in terms of how to deal with cases. So in the UK, there are sort of mostly broad lockdown measures in place, whereas in Hong Kong, we have lots of social distancing and working from home. But the main way to sort of limit the spread of the virus is through contact tracing. So finding people who have been diagnosed and finding all of their close contacts and isolating those people in quarantine centers. For example, for let's say if there was somebody who was diagnosed, their whole family would be sent to a quarantine center for 2 weeks. So that's quite different from the UK, which has policies where people are asked to stay at home and sort of self-isolate on their own. So as I said, the response in Hong Kong was mostly community-led in the beginning, and the government enforced countermeasures after pressure from the public. So in the first week of February, there was actually a strike of healthcare workers who were protesting that the government hadn't controlled borders so they hadn't enforced travel restrictions from people from mainland China. And they also wanted more hospital funding from the government. So it's kind of hard to describe just how strongly people feel about epidemics here. But I think it's because the experience of SARS was really traumatizing. It's something that I remember even though I was only 7 at the time. And there's still some criticism that can be made about the government's response that continues to be made by the public here. For example, incoming travelers are told to self-quarantine and they're given a wristband which monitors their location. But some of these measures aren't strictly enforced and people have sort of left their homes and gone to restaurants, which has led to further spread of the epidemic. So there are lots of measures that have been put into place in response to those kinds of methods of spread. For example, restaurants are being told to operate at half capacity and things like that. So there's also been a recent uptick in the cases in Hong Kong, and that's I think primarily because of incoming travelers. So people who maybe studied abroad and have returned to Hong Kong because they feel it's much safer here than it is in other countries. But this has again led to more spread of the virus. So the government has responded again to that, to these new cases by increasing the countermeasures. I think one thing that's probably important to note is that the strategy that we have in Hong Kong of contact tracing and case isolation is quite difficult to sort of scale up because it requires lots of healthcare workers and quarantine centers to be sort of put into place. And I hope that we move towards a more sort of testing and more targeted approach where we're just quarantining people who have tested positive by mass testing the population. So in terms of the fiscal and economic response, I think it's a little similar to the UK's, but not so much. So in February, the government offered businesses relief of loans up to 2 million Hong Kong dollars for every small and medium-sized enterprise with a guarantee. This cost about 20 billion Hong Kong dollars in total. They also offered cash handouts of around 80,000 Hong Kong dollars to small and medium enterprises. And they've also said that they would hand out cash of 10,000 Hong Kong dollars per adult in August, and that's supposed to stimulate spending. There's also a much larger government relief package of 30 billion Hong Kong dollars, which is directed at the healthcare sector, and it's to help firms that are involved in the tourism industry, catering industry, and some others. So I don't know as much about finance and economics as the others on this panel, but the public sentiment is that the financial measures have not gone far enough, and many businesses are struggling to avoid bankruptcy, especially restaurants and firms in the leisure industry. So I think one of the biggest benefits of Hong Kong's response is that many of the measures were taken very early, and just from an epidemiological point of view, that's a very smart thing to do, because it's much easier to contain the spread of a virus when only a small proportion of the population has it. And it's sort of hoped that the reproduction number of the virus, which is the number of people each case is expected to infect, if that is reduced below 1 thanks to social distancing measures or testing and isolation, then the cases is expected to decline exponentially. Whereas if it's above 1, it's expected to increase exponentially. So as long as you can have countermeasures that are implemented early and that are put in place for long enough, you can eventually see a decline in the new number of cases.
Well, thank you very much, Sony. That was a very helpful summary. So what I'm going to do now is just give a bit of a background on the Australian approach, both very briefly from a public health perspective, of course, not my area of expertise, but I'm just going to give a bit of background on where Australia is up to, and then a bit on Australia's economic approach. So I think Australia has put in a lot of effort to very much remain ahead of the curve, so to speak. One of the early steps, so Australia's very connected to China. There's large numbers of tourists and students and a huge amount of travel. When it was seen the extent to which China was responding to this pandemic, Australia also took the same approach as the US in terms of banning flights from China. So the government would argue that created kind of an essential time in which to prevent kind of broader spread within the community, that was then subsequently undermined by arrivals to Australia from other countries that in which it had spread, particularly from the US and across Europe. So Australia is probably about 2 weeks behind in terms of its both cases, maybe further than 2 weeks behind in terms of cases, but certainly about 2 weeks behind in terms of social distancing methods. So we saw about a week ago, things like pubs and clubs and gyms were closed. And then just this weekend on Sunday evening, after a meeting of what's called the National Cabinet, so Australia's decision-making process for COVID-19 involves quite a coordinated effort between state and federal authorities. So there's a meeting between the Prime Minister and all the state and territory leaders in Australia called the National Cabinet, where they're making consistent decisions between states. That's probably in contrast to the US, where states have moved quite differently. And Australia is now effectively, from a public health perspective, taking the same approach as the UK in terms of gatherings now limited to maximum of 2 people. Effectively, it's a stay-at-home kind of order. The only difference being that a lot more businesses are allowed to operate. So quote unquote non-essential businesses are allowed to operate, but in practice, most businesses that are non-essential have closed their doors. So overall, in terms of the number of cases in Australia, has actually been slightly reduced in recent days. Australia's got quite a widespread testing regime. It's now undertaken hundreds of thousands of tests and is amongst the top testing nations in the world. It hasn't been completely successful, but there is still the essential strategy to track and trace throughout the population of cases, unlike in the UK, where because there isn't enough testing at the moment, the community transmission isn't really tracked and traced anymore at this point. One key step Australia has taken in recent days as well is the decision effectively not only to kind of ban all foreign arrivals from Australia, but also to require all foreign arrivals quarantined for 14 days. And acknowledging the challenge that was also faced in Hong Kong about quarantine, it's now that the Australian governments, the state governments, are paying for people to quarantine in hotels for 14 days. And that's because from the government's analysis, 2/3 of new cases are coming from overseas. And therefore, there's a belief that you can stop the spread by stopping the overseas transmission. And it's only Australian citizens returning to Australia now who are going to be in that position because their tourism is now effectively shut off. In terms of the economic response from Australia, there's been a series of escalating packages from the government. In total, the promised 320 billion Australian dollars, that's 16% of GDP. There's been specific bailouts for sectors and particularly the aviation sector. There's been a lot of spending obviously on healthcare, just like in all countries to try to tackle the crisis. As well as now, most recently, Australia's in some ways replicated the UK job seeker scheme, but with some slightly different features. So it's a $130 billion scheme where rather than being 80% of people's income, you can have what's called a job keeper payment, which is a $1,500 a fortnight payment, which is expected to be taken up by about 6 million Australians. So you receive a business receives that payment if their revenue has declined by 30%, or if their revenue is more than $1 billion, it declined by 50%, and that's backdated to the 1st of March. So that effectively means even workers who are still working will have their wages subsidized in that scheme if the business has lost a lot of their income. The idea behind this, it being one income for everyone, is that it's a perception of it being more equitable and fair, that the government is giving the same level of payment to everyone. Of course, it does create perverse incentives in terms of effectively subsidizing lower wages rather than giving people on higher wages who might have a high cost of living a similar level of payment. But for all intents and purposes, it's really trying to achieve the same goal that Sam talked about earlier in the Australian context, which is to say, we hope that this can be a V-shaped recession in which the economy is able to bounce back relatively quickly, and we're going to try to put the economy in stasis. I might leave it there for the Australian response, just because we've got a lot of questions coming in that I think want to be able to answer. I think we're going to go to the first question I want to have it take a look at. I'm just going to change the view. The first question I want to take a look at is this issue of the extent to which we actually think that the governments can achieve their stated goals of putting the economy in stasis. We had our director, Eamon Butler, was asked, Sam says that seasonal businesses can shut down and then open up. But I know seasonal businesses in Holiday Island who say it's more like starting up a new business every summer, so it's not easy to reopen after the closure. What are the panel's views on the extent to which we can recover from this recession and the extent to which it will be V-shaped, or are we going to see some longer term consequences for the economy? Sam, do you want to go first?
Sure. Thanks. Yes, I don't want to suggest that it will be an easy task. And I think the longer it goes on, the harder it will be. But imagine if tomorrow we discovered that we had a vaccine and it took us a week to roll that vaccine out to every single person in the country. I think it's reasonable to assume that the economic cost of the shutdown that we've had for the last week or so will be quite small. And I think it's reasonable to assume that very, very few businesses would end up going broke. Very, very few people would end up losing their jobs permanently. and we would be able to get back to normal very, very rapidly. I think that's obviously very unlikely. So more likely is that we begin to try to get back to normal, probably without a vaccine, but probably with more widespread testing within the next few months. The longer it takes for us to make that adjustment, of course, the longer it will take, the harder it will be to do that. Partly because some businesses will not be able to stay afloat even with the employee retention scheme. Some businesses, I think, aren't aware of the scheme. They don't realize that they're eligible for it. They may be reliant on contractors rather than on PAYE workers, and hence ineligible for it. There are all sorts of complications. Any government program like this is going to have lots and lots of problems and is going to fail in lots of ways. The longer it goes on, the more things like that will bite, the more people will have to leave those jobs because they haven't been taking income, they'll have to take new jobs. And of course, the longer we're in this situation, it's quite right that we have more people being reallocated to new work. I mean, Amazon, all these delivery companies taking on new workers, that's a very rational and very good response to the new world that we live in. The downside is if it turns out that this new world that we live in is quite short-lived, then those people who've taken those jobs and possibly left old jobs that maybe in a different world they were better suited for, there will be a search period where they have to find new jobs, or they have to try and persuade their old employer to take them back. None of those things are trivial, but the longer that period goes on for, the harder it is. So I don't want to kind of downplay how difficult this is. But the counterfactual, the next best alternative, the thing that we would do without this kind of employee retention scheme, is just to have hundreds of thousands, if not millions, of people being made unemployed. I mean, the figures from the US that are being talked about are eye-watering. You're talking about worse than the Great Depression levels of unemployment. I don't know if this will happen, but we'll see what the public policy response is. We're talking about absolutely horrifying numbers of people. And even if you have a complete return to normal after that, the fact that the businesses that were employing them have wound up, the fact that they have left those jobs and they have to spend at least some time finding new jobs for themselves, that's a really, really long period of agony for lots and lots of people. And if we can avoid that period with public policy, then I think we should.
Okay, I think we might go on to the next kind of bunch of questions we have. We've got a lot of interest in both the kind of philosophical justification for allowing this kind of a lockdown from a liberal point of view. And then the question is also about the extent to which this can be maintained over time, whether or not this is something that is sustainable. I don't know if you want to take that, Morgan, potentially.
Sure. We've seen this talked about a lot, especially early on in the days in the lockdown when we were discussing kind of in newspapers and public debate what it would look like. There was a lot of discussion of where are the libertarians in this? Where are the kind of people who are liberty-minded? Are they going to be completely opposed to this? I think most people that you ask that are libertarians acknowledge the role for the state in exceptional circumstances, and this is certainly one of them. We do need a coordinated federal state response from this, and it's not an undue overreach of the state. One of the things we have to be careful about is how these restrictions are designed and how they're limited and how they're enforced. I think one of the things that we've seen in the UK is kind of the lack of clarity on what exactly legislation means and what exactly the spirit of the law is, and the letter of the law is being interpreted in very different ways by different police forces across the country. So you see stories of people getting sanctioned on their way to the store because they bought non-essential items. Who is to say what is a non-essential item? So I think the voice for libertarians is saying, yes, these measures are necessary both economically and socially, and we're willing to accept these restrictions on our freedom in order to prevent loss of life. But we also have to be sure that we are keeping a watchful eye on the government and making sure that they're being held to account, and making sure that we are preparing for when this is all over and when these restrictions can be rolled back. So I think one of the important changes that was made in the UK was the original legislation was scheduled to last for 2 years without any review, and that was rolled back to 6 months, partially due to organizations like the ASI and Big Brother Watch and other pressure groups unrelated to us, and it really is an important check on the government at this point, because we do need to give our support to their financial measures, but also keep a watchful eye that they don't overstep and restrict our liberties unnecessarily.
So Saloni, we've had a bunch of questions on the lines of raising skepticism about the necessity of some of the social distancing measures that have now been taken. And some questions about, is this really different to the flu, that it kills more people year to year? Why has it been necessary to take these steps? And have governments overreacted, or have we taken the right approach?
Yeah, so there are lots of, I guess first I'll tackle the question of how it differs from the normal flu. So there are lots of differences between the coronavirus and seasonal flus. The main one is that the World Health Organization actually recommends vaccines to be developed for the flu every single year, and they recommend about 3 or 4 different vaccine formulations to be created every year, and that's like a standard procedure across the world, and it reduces the harm that's done by a flu virus quite substantially, and we don't have that for this virus. It's new. There are lots of unknowns about it, and most of the data that we have currently suggests that it's much more dangerous than the flu is. It also, unlike the flu, has a much higher reproduction number, which is, as I said before, it's a measure of how many people a case is expected to infect, which means that it can very quickly escalate out of control. So it's very important to implement social distancing measures early, because that can sort of exponentially reduce the spread of the virus. But I think that maybe I'm a little more optimistic than many people who have commented on this, because I think that most of these lockdown measures are ways to sort of buy time to scale up testing and to scale up hospital capacity. And I don't think that they need to last for months and months. I think that these are measures that you implement when you're not sure where the virus is spreading. And once testing has improved substantially, we won't need to keep those lockdown measures in place and at the level that they are right now. So I'm quite optimistic for that. I'm also quite optimistic for antiviral treatments in the coming months. One of the reasons for that is that our scientific sort of capacity has increased substantially in the last decade. So we're able to, for example, sequence genomes in just a couple of days, whereas before it would take months and months. So we've sequenced maybe thousands of the virus's genomes in just a short amount of time, whereas in the same amount of time in SARS, it took about 4 months to sequence just one. So that's a huge difference. And there's also big differences in computational speed and stuff like that. Those things really help in developing a vaccine or finding treatments. The main barriers to move that into the public sphere are mostly regulatory. So trying to find out whether these have long-term side effects, and those are kind of influenceable by public policy. So if we opted to have more experimental treatments or experimental vaccines, it may not be as much of a problem.
I'm interested in the panel's view, and we've had a bunch of questions along the lines of, does this represent a permanent expansion of state power? In the sense that it's quite normal after crisis that the measures that are taken often can have some lasting effects. The classic being income taxes introduced for the purposes of war, but never actually withdrawn. And I'm wondering what we think about the extent to which potentially both some of the liberty restricting measures, some of the social distancing, but in particular some of the massive expansion of state spending. Do we think we're gonna see a lag, a quite substantial lag time in which these measures are just going to be kept on and on forever, or are we a bit more hopeful that this will be temporary?
I think it's reasonable to. I mean, who wants to be the person saying that this temporary government program is indeed temporary? But especially at an Adam Smith Institute event. But I think it's reasonable to, I mean, most of the major provisions, I think, have to be unwound. I think it's kind of inconceivable that the government will, allow businesses to just furlough their staff whenever they want to, and will just pick up the tab. I don't
and it
think
seems like the UK designed the measures to be temporary, because they're not things that they're not just new payments. So like the US has got this effectively a UBI now that could turn permanent, whilst the prolonging, it seems like a different approach there.
Yeah, and I think that the nature of this, I mean, I was really trying to stress how unbelievably unusual this particular kind of recession is in my remarks, and I think that speaks to the need for an exceptional response. Now, I'm somebody who's quite sympathetic to a UBI in general, but I think it's totally inappropriate for this kind of situation where even though many people are affected, they're not being affected evenly across the economy. Anybody who can work from home has no need for government support at this point. Any company that can have its people work remotely and isn't taking a hit to its revenues has absolutely no need for government support right now. So when you talk about a UBI, for example, since you've mentioned it, when you talk about a UBI, it requires lots of other things in the economy and the tax system and the welfare system to change as well. You need to eliminate certain benefits that are being paid. You need to change the way the tax system works, so you're not creating massive cliff edges, and so that you're taxing away the money that you're giving to rich people in a way that doesn't distort work incentives too badly. All of these things require lots of careful consideration and experimentation. An exceptional recession, a recession is a bad time to introduce this. The most exceptional recession we've had in a generation, or more than a generation, is definitely not the right time to be thinking about this. So I think it's a really blunt tool, and I think it's a really bad way for people who like the UBI to try to kind of get it onto the agenda. So even if, sort of kind of roundabout, to get back to the original question, I certainly hope none of these measures are made permanent, and I think it would be very damaging if even things that I'm quite sympathetic to in general, do become permanent. You just ended up with a kind of bastardized version with none of the painful decisions that have to be made, and just yet more difficulty being kind of kicked down the road for some other group of people to have to worry about.
And maybe Morgan, you can deal with this one. How are we going to pay this back? Are we going to have deficits, debts forever and ever and ever? Are we going to have hyperinflation? Are we going to see currencies devalued? Are we going to see higher taxes after this is all done? What are you seeing in your magic ball?
My magic 8-ball. I was exactly going to touch on that. I think besides the permanency of these measures, again, many of these aren't designed to be permanent, but there probably are a few that might slip into kind of general consensus, shifting of the Overton window, if you will, as cliche as it is. But what's more important is figuring out how we're going to pay for this, because we know how much it's going to cost. US is costing trillions. It's going to cost billions, if not more, here. So what are we going to see? We've seen an expansion of spending, so we can roll back some of that spending, but we're going to have to do more than just roll back spending. My worry is that we're going to venture into massive expansion of the tax code. If you think about the damages this is doing to corporations, in my mind, one of the worst things you could do would then to be hike corporation tax, because talk about kicking someone while they're down. We need to be careful about these measures that we try to do to readjust this deficit that we're getting ourselves into. And we need to be very careful about what sort of tax measures we put in place, any sort of fiscal policy. I mean, interest rates down to zero, kind of, they're already trying to play with the system, so we have somewhere to go. But really, we just need to be careful that we are not burdening people for too long. But when you're getting into the trillions, it on top of massive national debt already,
it's a trillion here, a trillion there. Suddenly, you're starting to talk about some real money, aren't you? Yeah,
exactly. So
I think we have to be clear. Any debt is deferred taxation. Any amount of money that we borrow is just another version of tax. But it's often appropriate to tax people, and it's often appropriate to spend money. I think it's very good that in the UK, in the last 10 years, we've sort of developed a culture that is very, very resistant to borrowing. I think when it comes to I'm very pleased. I think that's one of the real successes of austerity, is that any party manifesto that comes out with unfunded spending commitments is kind of lambasted. and can really help you lose an election, as we've seen.
Yeah, and I think it's also important to acknowledge that the UK was in a much better fiscal position to be able to deal with this crisis because it spent the last 10 years not perfectly saving. I mean, there were still debts and there were still deficits, but at least trying to reduce the deficit to zero and start paying back the debt. If the UK had, Jeremy Corbyn level spending for the last 10 years, it would be a complete fiscal calamity to now spend all this additional money. It's more affordable.
Yeah, but we have to, yeah, exactly. But we have to be clear that being resistant to debt financed spending or tax cuts in general doesn't mean that you should be against the use of debt in every situation. It doesn't mean that just debt is an evil thing. Sometimes in a case where the entire economy has taken this really bad hit, where it's just impossible to imagine a private insurer that could exist that could insure people against this risk because it affects so much of the economy. There's no pooled risk here. There's no one who could be in the pool who is not affected by this. So private insurance doesn't really work. The only possible, I think, the only possible kind of insurer of last resort is the state, because it can insure in an intertemporal way. It can expand the risk pool to not just be people who are around today, but to people who are around in 30 years time or in 20 years time or in 10 years time. And that's a very rare power that only the state has. And so yes, it is tax, it is borrowing, it is debt, but this is one of those rare occasions where it's necessary.
we're just running out of time. I just want to put one last question to you, Selena. We've got a lot of questions on the theme of how to future-proof. I suppose this is both from a health and as well as an economic perspective. If you think from a Nassim-led perspective, we do have long tail risks, unforeseen circumstances that have quite extreme consequences. What steps do you think we can learn from this? Perhaps Hong Kong already learned it from SARS when it comes to pandemics, but how do we think about institutions and structures that will deal with these high intensity events that completely throw out the world economy?
So that's a really good question. I think the way to think about that is firstly to think about how these sort of epidemics emerge in the first place. So when it comes to the coronavirus, for example, it's as far as we know, it's a zoonotic disease that came from coronaviruses in bats. So sort of taking countermeasures to increase or improve hygiene standards in sort of the meat markets and sort of farms and zoos and things like that. That's very important. Also, improving sanitation measures in general would be a huge benefit. And I think that that's something that we've seen in the 20th century. So improvements in sanitation in general and sort of general like hygiene practices in hospitals is a very good starting measure.
I think we might just go to some final comments from each panelist. Unfortunately, we've had probably about 100 and well over 100 questions, and we haven't been able to answer all of them. If there's anything anyone would like to touch on, maybe Sam, you first, and we'll go around.
Sure. Well, there was a great question from Gabriel Stein, who I'm a big admirer of, who asked, how long is it possible to maintain this kind of lockdown in a free society? And I agree that 3 months, I think, seems tolerable. But if we're talking 6 months, 9 months, that becomes much more difficult to sell. But I think that Saloni makes a really important point that every single day that passes, we're learning more about the virus. For example, how many people knew that losing your sense of smell or taste was a symptom of the virus 3 weeks ago? This is only something really, as far as I know, that has become widely known in the last couple of weeks. So even when it comes to the symptoms of the virus, we're learning more things, which should make it easier to catch people who have it. We're getting better at controlling it. We're building more testing kits. We're soon apparently going to have an antibody testing kit, so we can identify people who have had the disease and are hopefully immune for some period. I hope we will overcome some of the quite silly privacy laws that we have and start using the fact that every single person has a location tracking device in their pocket almost all the time. to do really, really good contact tracing. I really hope we start doing that, because that could be a huge, huge way of doing contact tracing. And we're getting better at treating people who are ill. We're building more ventilators and we're building more ICU provisions. So my amateur view is that buying more time is very valuable. And my view as an economist is that the value of doing so and the value of avoiding this huge 500,000 people dying is enormous. If you think about people, even people who are quite old in their 60s and 70s dying, you're talking about 10 or 11 years of life lost. And using the government's numbers, that's £500,000 per person in terms of the kind of statistical value of a life. So if you want to think about this in cold economic terms, then avoiding 500,000 people dying is equivalent to avoiding a 30% one-year recession. You know, there's almost no one-year cost we can imagine that would be worse than allowing these people to die. Now that's thinking of it in very coldly economistic terms that I don't think that anybody would actually want to think in terms of. But if you do want to do a kind of cold cost-benefit analysis, the value of keeping people alive and stopping very elderly people dying from this virus, including as well as all of the younger people who will die of it, is absolutely enormous. And I think it's really hard to make a kind of numbers-based, calculated argument that it's worth having all these people die to keep the economy going normally, even if that were possible, which it isn't.
Well, thank you very much, Sam. I've seen the ASI Twitter account making note of my lack of decorations. Feel free to donate to the Matthew Leshman Ambulance Fund if you'd like to contribute to my home decorations. Morgan, over to you.
In terms of final wrap up, I guess I feel quite lucky to be living in the UK right now compared to the US. I am worried for a lot of people in the States, if I'm being honest. I think that kind of the measures that the UK have taken to prevent the spread, but also provide the economic support that you need to take those measures. One of the things I didn't get to touch on was, although the states are leading the public health push, they're doing it at the expense of their economies, because when they implemented their measures to keep people home, social distance, close restaurants, etc., they didn't know for sure what sort of federal support they'd be getting financially. So they did that kind of at the detriment of their own states, but they did see, like Sam says, the importance of preventing loss of life. So I do feel very lucky to be living in the UK, where the government took those steps in tandem and made it so that most people, I know that there were issues with self-employed people and people who are still key workers and have to go to work or aren't sure if they're key workers. You still have those issues, but taking those two things in tandem, providing the economic support so that people can work from home while encouraging them to social distance and making sure the businesses can afford to close for the time being. Those two things taken in tandem are really essential. Doing one or the other won't solve this. And I guess those are my final thoughts.
Saloni?
I guess I sort of wanted to go back to the point about what we can do in the future to prevent spread of similar sort of viruses and pandemics. And I think the key messages are to find out where these infections emerge, reduce the spread of like transfers of viruses from animals to humans, reduce the spread of those viruses or bacteria between humans through sanitation or just more general hygiene standards, and finding ways to treat people and develop vaccines. And I'm quite optimistic about that.
Well, thank you very much, everyone, for joining our first ASI webinar. This has obviously been challenging times for everyone, but we can assure you the ASI is fully operational. We're going to be hosting a whole array of events. We've got upcoming research that's going to be tackling a lot of the issues we've discussed today, as well as continue to contribute to the public debate in these difficult times. I'm very excited to announce that we have now released the details for our next webinar, which will be next Tuesday at the same time, 6 p.m. So it's going to be hosted by my colleague, Matt Kilcoyne, but we've also got a fantastic group of panelists. We've got Shoshana from R Street Institute, Stephen Hamilton from George Washington University, and Madeline Grand from the Daily Telegraph will all be joining. I'm just posting the link. You can register today, and I look forward to seeing you then. Have a good evening, everyone, and stay safe.
Thanks very much. Bye.
Thank you.
Thanks.